r/AskReddit by Redmond Dts. Doctors, what is the scariest thing a patient has ever done or said? A patient once looked at me with a completely calm face and said, "I know you're trying to help me, but I'm going to die today. I've made peace with it, and you can't stop it." One of the most gut-wrenching moments in my career was when I was treating a 9-year-old boy who was the victim of significant blunt force trauma. He was unstable, but awake and talking. With terror in his eyes, he started thrashing around in his bed and screaming, "Don't let me die, I don't want to die." It made us all nervous and tense. He went to the operation room and survived, but that was 5 years ago, and I can still see his face. My 3-year-old daughter passed away from flu that turned to sepsis. She was so scared in the end you could hear it in her voice. She called for her mom till the end. It haunts me still. During my med school trauma surgery rotation, our 16-year-old patient said, "My stomach hurts," right before he was intubated for an exploratory laparotomy. He had gotten shot in his abdomen. Intra-op, we noted that the bullet tore a hole in his aorta. He didn't make it. Such innocent last words to hear a kid say. He fully didn't grasp his fate at the time. And understandably so. I will never forget it. As a resident working off service, looked a woman dead in the eye before we were about to intubate her. She had the saddest look in her eyes and said, "Don't let me die." She had awful esophageal and rectal varices that were never successfully treated and passed away that night in the operation room. Still see it in my thoughts from time to time. The scariest thing I ever heard working in healthcare was not from a patient, but a nurse who called me to report an outbreak of rabies at one of the nursing homes I worked in senior management for. I managed to stop myself freaking out for long enough to ask her the necessary questions. Thank goodness, English wasn't her first language, and she'd got 2 words confused. Scabies. She meant scabies. Not a doctor or a nurse. One of my uncles had stage 4 pancreatic cancer. He was a tough guy and didn't trust hospitals, so he didn't see a doctor until it was way too late, despite being in debilitating pain. When he did, the prognosis was grim. He had maybe 6 weeks left, and pancreatic cancer is a painful way to die. He decided to get medical assistance in dying instead, which is legal in Canada. On the day we were all gathered around his bed, all the paperwork and permissions were sorted out, and the syringe of drugs was connected to his IV. He was heavily sedated, but he has to be the one to push the plunger, which he did with the help of his wife. He closed his eyes and his breathing got very shallow and slowed down. After a few minutes we thought he had passed. We were all standing around him, some saying goodbye, a lot of people were crying. About 10 minutes passed, and people started to leave, when suddenly, in a strong clear voice he said, "Russell, wait for me," then he was gone. Nobody knew who Russell was, and it was kind of a mystery we talked about from time to time. Years later his wife passed, and when his kids were going through her things, they found a very old photograph of him, when he was maybe 5 years old. He was in a sandbox with a small dog. On the back of the picture in faded ink, it read, "Russell 1944. The thought that our pets, that have gone before us meet us to help us cross over fills me with comfort. I hope it isn't just a mind trying to make sense of a crazy time." Not a doctor, but before my grandfather passed of pancreatitis, I'll never forget when he looked up at me and told me that, "Don't worry, they're already here, all of them," before dying. Not really sure what that means, but it creeped me the F out for a few years. On a lighter note, my other grandpa died a little bit after I walked into the room with a new mustache I was trying to sport. He laughed at it, and I like to think about that sometimes. The very last thing he did after a full life of ups and downs was laugh at my stupid mustache. Doctor here. First one that sticks to mind isn't so much what the patient said, but more her body language that clued into what was going wrong. Story: I was a medical student at the time, and the city my school was in is a hub for human trafficking. I noticed a patient in the ER who had a pretty bad injury to her face, was with a sketchy looking guy who was not related to her. She wasn't my patient, but I brought my gut feeling up to her doctor, who then made up some excuse to talk to the patient alone and got her to help. Turns out she was a victim of human trafficking. I never talked to her myself, but I couldn't shake the vibe I got from looking at her and the man she was with. As a resident, a patient was super angry and signing his papers to leave against medical advice. He looked at me and said, "I know what time you sign out, and I know where you all leave the hospital." Looked over my shoulder the entire walk home. First month as an intern. At this point I know everything to crush med tests, but nothing to handle a patient. Only doctor covering the night shift at a VA, code green, which at this location means a patient is hostile. Jog around a corner. Find Mr. S, who I admitted a few hours earlier, now sundowning, and holding a piece of broken glass in front of him like a knife. Sundowning is when an elderly, maybe demented, patient has increased confusion, plus minus agitation early in the night, especially in an unfamiliar setting, which every hospital is. He's holding the broken glass towards the charge nurses and screaming nonsense, mainly F-bombs, and wanting to go home. Me too, man. 2 police officers are standing a couple yards in front. One touching his sidearm. Nurses and techs are lining the hallway. Lights are on, TVs are on, Mr. S is not enjoying his stay. Everyone looks at me, the youngest, least experienced. Why not? So, what do you do? First thing, greet Mr. S. I admitted him, so I knew he was a good guy in a confused state. I never mentioned the situation, just started random polite conversation. Next, motioned for the cops to leave, the extra nurses and techs to leave, turn off the TVs, turn off the overhead music, turn off some lights. De-escalate everything. And then with just the charge nurses and I in the hallway, minimal stimulation, we waited him out. Eventually he forgot about what he was holding, as we talked about his wife, and fishing outside the city. We did end up giving him a sedative, once the danger passed. Not sure if I should have. And the next day we got him home. Had a patient who had just had a major surgery throw himself out of bed, because Freddy Krueger told him to do so. He was on a ketamine drip for pain management at the time. I can see death standing behind you. Still haunts me, and he passed away 2 days after. I've got one. I'm a psychiatrist with a distinct and relatively rare appearance. Because of this, I've spent my whole life hearing that I look like anyone with a vaguely similar skin tone or hair color, even when I didn't see the resemblance. Fast forward to my intern year. A patient comes into the emergency department after being found severely hypothermic, so much so that he was initially pronounced dead. Miraculously, he was resuscitated, but his identity was unknown, and as he began recovering, he started displaying signs of psychosis. That's when the primary team called in a psych consult, and I went to assess him. The moment I stepped into his room, I was taken aback. The man lying in the bed was a spitting image of me, except he looked like an alternate version of myself, one who had gone down a much darker path. His face was weathered, likely from drug use and homelessness, but the resemblance was unsettling. As I tried to gather details about his identity and psychiatric history, he locked eyes with me, his stare intense and unshakable, and said, "I'm you." That became his only response whenever he spoke to me. For 3 days, every time I interacted with him, all he would say was, "I'm you." Being a sleep-deprived intern, this messed with my head more than I'd like to admit. Seeing someone who looked eerily like me, who had literally been pronounced dead days earlier, repeating that phrase over and over. It freaked me out to say the least. After a few more days, and as he started coming down from meth-induced psychosis, I finally got through to him. I explained that he couldn't be released as a John Doe, and that we needed his identification. Eventually, he gave me his social security number. When we ran it, we discovered he had multiple out-of-state warrants. The whole experience shook me, and I definitely lost some sleep over it. Even now, it still sticks with me. Not a doctor, but a nurse. Once, a psychotic schizophrenic patient got me. And it was because of how normal she said it. Screaming, threatening to kill me, and then sitting on the commode. And then calmly looking at me, and says in the most normal and monotone voice, "I'm sorry, I know I'm not well, and being mean to you. I'm in hell, and I don't know how to get out." I will never forget that, or how it made me feel. It's like she had a 10-second lapse of her manic episode to apologize and tell me how she felt. Made me super empathetic to my psych patients. Nurse here. Had a patient going through opioid withdrawal. Asked if I could give him an injection of a certain blood thinner. He said yes. He didn't like that the injection hurt. He leapt out of bed, backed me into a corner, and threatened to smash in my skull. He reiterated he once killed a police officer by beating him to death, and he wanted to do the same to me. He was 6'2", I'm 5 foot. I managed to de-skill it the best I could, gave him his opioids, encouraged him to go for a walk off unit to let off some steam. It worked. But before he walked off unit, he told our charge nurse he was going to kill me. Management, security, and the doctor did F all. Had to spend the next few shifts worried I was about to get my ass beat. One of the scariest things I've heard as a doctor came from a patient who calmly said, "I see the man in the corner again." There was no one there. The patient was fully alert and oriented, but their vitals were crashing fast. Moments later, they coded. Another eerie moment was a patient who came in after a traumatic accident. Right before surgery, they grabbed my wrist and said, "Don't let me die, doc." Their vitals were stable, but despite our best efforts, they didn't make it through the operation. The things patients say, especially in their final moments, can stick with you forever. Probably not what you are asking, but the thing that I've been most scared to respond to was a 7-year-old Irish girl stopping me talking to her mom and first asking me if I was a doctor, which I responded yes to, and then asking me very frankly if her dad was going to die. Given that he was intubated on 2 pressors with a multi-drug resistant infection on top of a hematological malignancy, the real answer was most likely. Striking a balance between remaining honest and not adding extra trauma to her experience, knowing it could possibly be something she carries with her for her entire life, without preparation. I was on a consulting team, not the primary team, so wasn't on the team designated to discuss goals of care and overall expectations, was terrifying. So I told her that I didn't know, and her dad was very sick, and it might take us a long time to know what would happen, but a whole team of doctors and nurses were going to keep trying their best to help him get better. He died several days later. I'm a physician assistant, not a doctor, but to me, it's always the scariest in the hospital or emergency room setting when someone says, "I think I'm going to die." Because often, they're right. That's all folks. Thank you for watching. If you like videos like this one, why not like and subscribe for more? Have a nice evening.